The widespread criminalization and punishment of people who use drugs. The overcrowded prisons mean that the war on drugs is to a significant degree a war on drug users, a war on people. That's an African, Kofi Annan. And he was speaking as he also played game at the time. It's a war on drug users, it's a war on people. Okay? And then the UN office that is responsible for drugs, the United Nations Office on Drugs and Crime, says that the production, trafficking, and consumption of these drugs are not really understood properly. We are seen in their many different dimensions: the political, the social, the economic, and the cultural. The drugs issue that intersects many different domains: law, criminal justice, human rights, development, humanitarian law, public health, and the environment. So they also agree that, you know what, this is not just about the criminal justice system. This is much more beyond the criminal justice system. And I think we have to look at this holistically. But the most important thing here is the harm reduction model that we're advocating. The harm reduction model that the Harm Reduction Network advocates, rather than the criminalization model, which looks at the people who use drugs as criminals. So, it's not my turn. I simply wanted to highlight those two things. It's the turn of Uganda Harm Reduction Network to discuss or to make a presentation or to say something and then launch this report, and then we can have a plenary. So, Mr. Baguma Christopher from UHRAPF.
Adrian, thank you very much. Once again, good morning. I'm Baguma Christopher, the Programs Manager, Uganda Harm Reduction Network. First of all, I'd like to thank HRAPF and the lead researcher, Doctor, for the great work and informative piece of work that you've come up with that will inform us in the next programming as Uganda Harm Reduction Network and all those like-minded CSOs that champion the cause of drug users. Uganda Harm Reduction Network, since inception, that's 2008, we've been advocating for the rights of drug users and advocating for the adoption and implementation of the 9 harm reduction interventions through various stakeholders, that's particularly the government. So with this kind of work, which we've come up with, is going to be the material or the literature that other researchers will begin from there, and other scholars that will take interest in what you've come up with. I would like to add on the voice, the community members, the people who use drugs. Thank you for the work you did. Abantu baffe be tukolagana nabo mwebala omulimu gwe mwakola nnyo okulaba ne mukola ki ebirowoozo byammwe ne babikola ki ne babigatta mu ripooti eno gye tugenda okwanjula olunaku lwa leero. I remember some time back at the beginning of this year, Lynette and Edward came to our office and we were trying to conceptualize. We have these laws. For us as an organization, we don't know those legal gymnastics. We don't know what the law is all about, but we know it's there. But we are asking ourselves, what can we do to make sure that we bring out the voices of people who use drugs and to analyze these narcotic laws and link them to health and other issues that affect the drug users. So we had a discussion. As Uganda Harm Reduction Network, we had no funds. We said, but we don't have funds, but it's a good idea. I would like to thank HRAPF. During our discussions, they said, hey, look here, we have some funds, we have a basket where we can do this work, but what we need from Uganda Harm Reduction Network is to team up and work together to make sure that we come up with this report, which will be used for future programming. So HRAPF, thank you very much for coming up with such kind of work. Please give them a clap. Yeah, let me go to the report. I have not intensively read, but I have perused through. And there are a few things that we are going to look at. In the report, you will see most of the people who were interviewed or consulted, most of them were agitating for the harm reduction interventions. As Uganda Harm Reduction Network, for us, we take the drug use. It's not a criminal issue, but it's a public health issue. So if we want to make sure that this issue is tackled, we need to follow the public health approach. The war on drugs globally, no country has won the war on drugs. So Uganda, we are not different from these other countries. So what we should do, we should copy our brothers and sisters. For example, Tanzania and Kenya already they have started adopting harm reduction interventions within their countries. Whereby of recent, we had a team from Uganda Harm Reduction Network and policymakers, health service providers, law enforcement, who went for a study visit in Nairobi, go and tell the story. Go, come back and tell the story. So at least we've gone ahead to make sure that even these policymakers get to know how it's done in other countries. And if it's done in other countries, that means it can be done here in Uganda. As Doctor was saying it, you find that when drug users are arrested, they are taken to prison. But you find that in prison, that's a real den of drugs. Hardcore drugs are found in prison. So all along, as Uganda Harm Reduction Network, we've been advocating for introduction of rehabilitation centers within the country. The rehabilitation centers within the country are private and are very expensive. Imagine in a day, you spend in a rehabilitation center a range of 80,000 to 100,000 per day. And you find that, who are these people? These are the committed people that are being criminalized. And these are the committed people that would like these services which are not affordable according to them. Now, what are we going to do? This is where I call upon all CSOs, government partners, and other relevant agencies to team up, and we come up with a strong voice, one voice, and we make sure that we advocate for harm reduction interventions within the country. I know it's not easy. Since we started as Uganda Harm Reduction Network, most of the people thought we shall not make it even beyond the second year. But here we are making strides, and of recent, at least within the facilities, with mapping, the way Doctor stressed it in the report, they are trying to make sure that they offer services to the people who use and inject drugs. Slowly by slowly, we shall reach there. I thank HRAPF again. You've made it for us. This is what we've been looking for. In various forums where we've been trying to advocate and agitating for the rights of drug users. The first question would be, where are they? How many are they? But this report is going to give us an insight that these people are there. If these people are there, it means we know where to do what? To find them. After knowing where to find them, the report also highlights most of the issues that affect this category of key populations. So the government partners, sometimes when you're fundraising, that's also one of their questions that come across. Are these people really there? So the government partners who are with us in this room, these people are really there. Next time, when I knock at your door, when I try to introduce the idea to program for these people, please, we shall be referring to this report. I know most reports are going to come out. This is more of a qualitative report, but we are going to have a size estimation report, which is going to show us exactly how many are they and where are they. I know, Doctor, you would have gone in those dens, you saw where they are, And the numbers are those that you interviewed. They are not only those, but others are there across the country. It's not Kampala alone, but across the country. So I would like to call upon all of us who are here and those who have read the report. Let's look at the back, at the end of the report. You will see the recommendations. Each sector, the judiciary, EPP, the police, what Uganda Harm Reduction can do, and other civil society organizations. We should build. This is the beginning and the genesis. So they have given us where to start from. So where are we going to start from? So the genesis is from the recommendations. So those recommendations, let's take them seriously and try to see how we can incorporate them into our programming in different sectors of this country. What I would like to say finally, I don't want to take a lot of time. I would like to call upon all the participants, and by the powers entrusted to me by HRAPF and team, I think it is the time I call all the members to join me and we launch this beautiful report. Maybe I will need guidance. HRAPF, I don't know, Juko, how should we launch it? Should we take a group photo?
We can have a few people coming up, especially the community members.
Yes.
And they join us there and raise the report and we have launched it.
All right, thank you for that guidance. I call upon few community members, few CSO leaders to come in front. We hold the report and launch it.
Community members, say community launch. Let's launch the report.
Please come and join.
Gender balance. Where are the women and the transgender people? Yes. Yes, they are. Yes. Exactly. Very good.
I think we can raise our books higher, and then from now on, I launch this report for public consumption and other sectors. Thank you very much. Thank you for coming. Thank you very much.
Thank you, Chris. McLean, how do you consume it? So, that is McLean. That's not what HRAPF has said. You can speak Gambo via HRAPF. You can via McLean. That's what you add at the words of McLean. It's the words of HRAPF. So thank you very much, Mr. Waguma Chris from Uganda Harm Reduction Network, for launching the report and also for the making the communication that you've made. And thank you for the nice words you said about HRAPF. We appreciate the collaboration that we have with UHRN. We appreciate your support in this research. Also, we really want to thank you for allowing us access to go and meet the community members.